Good evening, everyone. I welcome you all to the Week 10 live problem solving session for NPTEL Bioinformatics Algorithms and Applications course. So, this lecture initially mostly will be starting about protein interactions. Protein interaction plays a crucial role in various biological processes, including cellular signal, enzymatic activity, and gene regulation. Understanding protein interactions is fundamental in drug design, as many diseases are caused by the disruptions or dysregulations in these interactions. By targeting specific protein-protein interactions, researchers can develop drugs that modulate cellular pathways and restore normal function, offering promising therapeutic interventions. The process of drug design often begins with identifying the key protein interactions involved in the particular disease pathway. This may involve techniques such as structural biology, molecular modeling, and high throughput screening. Once these interactions are characterized, one can design molecules, often referred to as ligands or inhibitors, that selectively bind to the target proteins, either enhancing or inhibiting or reducing their interactions. Computational methods are employed to predict how potential drug candidates interact with their target proteins. This allows researchers to optimize drug molecules for improved binding affinity, specificity, and pharmacokinetic properties. Overall, protein interaction is intricately linked to drug design, serving as a cornerstone for development of novel therapeutics. By leveraging the understanding of protein interactions, one can design drugs that effectively modulate the biological pathways, offering new treatments for a wide range of diseases. First one, I'll be starting with this protein ligand interactions. These interactions encompass a wide range of physical and chemical forces such as hydrogen bonding, van der Waals interactions, hydrophobic interactions, and electrostatic interactions. They determine the stability and specificity of the complex formed between protein and ligand. Protein ligand interactions plays a pivotal role in various biological processes, including signal transduction, enzymatic analysis, and regulation of gene expression. So we have two classes of ligand types, that is endogenous and exogenous ligands. Endogenous ligands are naturally occurring molecules within the body, such as hormones, neurotransmitters, and metabolites, which bind to proteins that regulate the physiological functions. Exogenous ligands originate from external sources and include drugs, environmental toxics, and dietary compounds. They can mimic or modulate the action of endogenous ligands by binding to the same or different binding sites on proteins. So binding sites are regions on protein surface where the ligand binds with specificity. These sites often possess complementary shapes, electrostatic potentials, and chemical properties to accommodate and interact with the ligand. Proteins may have one or multiple binding sites, allowing them to interact with the different ligands simultaneously or sequentially. So the pose of binding refers to the specific spatial orientation and conformation adopted by the ligand within the binding site of the protein. It influences the strength and specificity of protein ligand interaction by determining the complementarity of molecular surfaces and formation of favorable interactions between the functional groups. The pose of binding directly affects the affinity and selectivity of the protein ligand interaction. A favorable pose maximizes complementarity interactions between the ligand and protein, resulting in stronger binding affinity and specificity. Changes in pose of binding, such as alterations in ligand orientation or conformation, can modulate the strength and specificity of interaction, thereby influencing the biological activity of protein ligand complex. Examples include in the central and the nervous system, neurotransmitters such as serotonin, dopamine, and acetylcholine bind to their respective receptors, initiating cellular response and neurotransmission. Hormones like insulin, estrogen, and adrenaline bind to their Specific receptors in endocrine signaling pathways regulating physiological processes such as metabolism, reproduction, and stress response. Drugs interact with the drugs interact with their molecular targets such as enzymes, receptors, or ion channels to modulate biological pathway and treat diseases. So the above the examples that way. So this also examples also include antibiotics targeting bacterial enzymes or anti-cancer drugs inhibiting the specific facility. So here I have a question. So endogenous ligands are, so whether endogenous ligands are considered as naturally occurring molecules within the body or foreign substances introduced from external sources, synthetic compounds designed in laboratories, or proteins involved in catalytic reactions. Here the question states that endogenous ligands are the naturally occurring molecules within the body, foreign substances introduced from external sources, synthetic compounds designed in laboratories, or proteins involved in catalytic reactions. Okay, as I discussed in previous slide number 2, the endogenous ligands are naturally occurring molecules within the body. So examples include hormones, neurotransmitters, metabolites which bind to the proteins to regulate their physiological functions. The opposite of endogenous ligands is exogenous ligands which originate from external sources and include drugs, environmental toxics, and dietary compounds. They can mimic or modulate the actions of endogenous ligands by binding to the same or different binding sites on proteins. Next question I have is, pose of binding refers to the location of protein within the cell, the specific spatial orientation or conformation of the ligand within the binding site, the mechanism of enzyme catalysis, or the structure of DNA. What is the pose of binding referred to? The pose of binding refers to the specific spatial orientation and conformation adapted by ligand within the binding site of a protein. It influences the strength and specificity of protein-ligand interactions by determining the complementarity of molecular surfaces and formation of favorable interactions between the functional groups. This pose of binding can directly affect the affinity and selectivity of protein-ligand interactions. A favorable pose maximizes the complementarity interactions between the ligand and protein, resulting in stronger binding affinity. Changes in pose of binding, such as alterations in ligand orientation or conformation, can modulate the strength and specificity of interaction, thereby influencing the biological activity of protein complex. So the binding of ligand to a protein can be described using the equilibrium binding equation, also known as the law of mass action. This equation relates the concentration of a protein and ligand and their complex at equilibrium, as well as the dissociation constant Kd, which is a measure of the strength of the interaction. The general equation for protein ligand interaction is protein plus ligand. A reversible reaction gives rise to protein ligand complex Pl. So in this equation shown, P is the protein, L is the ligand, and Pl is the protein ligand complex. The equilibrium constant for the binding reaction, calculating the dissociation constant Kd, is concentration of the protein multiplied by concentration of the ligand divided by the concentration of protein ligand complex at equilibrium. The dissociation constant represents the concentration of ligand at which half of the available protein binding sites are occupied. It is a measure of the affinity of the protein for the ligand with a lower Kd, indicating a stronger interaction. The binding of a ligand to a protein can be influenced by various factors such as pH, temperature, salt concentration, and presence of other molecules. These factors can affect the shape and charge of the protein and ligand, as well as the strength and specificity of their interactions. So understanding this binding affinity of ligands to proteins is important in various fields such as drug discovery, biochemistry, and biophysics. By determining this dissociation constant or binding affinity values and other parameters of protein ligand interactions, one can design and optimize ligands that bind to specific proteins with high affinity and selectivity, leading to the development of new therapeutic and diagnostic tools. So now with this I want to start with the concept of drug design. So drug design, also known as rational drug design, is a creative process aimed at discovering new medications based on understanding a biological target within the disease area or a person. Typically, drugs are small organic molecules that either activate or inhibit the function of a biomolecule such as protein, leading to therapeutic effect in patients. The core idea behind drug is to create molecules that perfectly complement the shape and charge of the biological target they interact with. This complementary fit allows the drug molecules to effectively bind to the target, influencing its activity in a desired way. Computer modeling techniques play a crucial role in drug design, allowing researchers to predict how well a potential drug molecule will interact with its target. This approach, known as a computer-aided drug design, and helps identify promising drug candidates more efficiently. So under this computer-aided drug design, we have structure-based drug design, which is a specific approach within the drug design that relies on the detailed knowledge of three-dimensional structure of the target biomolecule. By understanding the structural features of the target, researchers can design drugs that precisely fit into the protein's binding site, enhancing the binding affinity and specificity. That is, thereby one thing is getting recognized into the binding site and also forming the accurate pose of binding. In addition to small molecules, biopharmaceuticals such as peptides and therapeutic antibodies are also important class of drugs. Computational methods are used to improve the affinity, selectivity, and stability of these protein-based therapeutics. While drug design techniques are successful in predicting binding affinity and optimizing other properties like bioavailability, metabolic half-life, and side effect remains still challenging. So these characteristics are critical for ensuring the safety and efficacy of a drug, and they often require extensive experimentation and refinement during the drug development process. To address the high iteration rates in drug development, researchers are increasingly focusing on selecting candidate drugs with favorable physical properties early in the design process. In vitro experiments combined with computational methods help to identify compounds with better absorption, distribution, metabolism, and excretion profiles as well as reduced toxicity. That is, these computational in vitro experiments and combined computational methods help in regulating the ADMET properties, that is absorption, distribution, metabolism, and excretion properties. Drug discovery is a process of finding new medications to treat diseases. It involves two main approaches: phenotypic drug discovery and rational drug discovery. Phenotypic drug discovery, also known as forward pharmacology or classical pharmacology, it involves screening collection of synthetic molecules, natural products, or extracts within the libraries to identify substances with beneficial therapeutic effect. The method starts with discovering the functional activity of drugs, followed by target identification. It's a practical and target independent approach aimed at finding pharmacologically active compounds and therapeutics that work through novel drug mechanisms. So, this method of phenotypic drug discovery particularly useful for diseases with unknown, complex, or multifactorial origin, where understanding of molecular targets is insufficient. Then we have racial drug discovery, also called reverse pharmacology. So, this rational drug discovery begins with the hypothesis that modulations of a specific biological target may have therapeutic value. So, requires two key pieces of information: evidence that modulation of target will be disease modifying, and confirmation that target can bind to a small molecule and its activity can be modulated. Once a suitable target is identified, it is cloned, produced, and purified, following establishing screening assays and determining the conventional structure if possible. The search for small molecules that bind to a target involves screening of libraries of potential drug components, either to wet screens using the assay or a virtual screen so the target structure is available. So the ideal drug candidate should be drug like possessing properties predicted to lead to or sorry predicted to move a stage of lead to oral availability, chemical stability, metabolic stability, and minimal toxicity. Various methods exist to estimate drug likeliness and predict drug metabolism, but drug design still relies on the element of luck and the bounded rationality due to the complexity of optimizing multiple drug properties simultaneously. So, to predict the drug likeliness of the molecule, we have Lipinski's rule of 5. So, in summary, this is phenotypic drug discovery focus on identifying drugs based on their observed therapeutic effects, while rational drug discovery starts with a specific target and aims to design drugs that modulates its activity in a desired way. Both approaches are essential in a quest for new modifications to treat diseases. The Lipinski's rule of 5, formulated by Dr. Christopher Lipinski in 1997, is a set of guidelines used in drug discovery to assess the drug likeliness or pharmacokinetic properties of potential drug compounds. These guidelines are based on empirical observations and aim to predict the likelihood of a compound being orally available, which is crucial for its effectiveness as medication. The rule of 5 states that includes molecular weight, lipophilicity, that is log P value, hydrogen bond donors and hydrogen bond acceptors. The molecular weight of a compound should be less than 500 daltons. The calculated octanol water partition coefficient, that is log P, lipophilicity value, should be less than 5. Log P is a measure of a compound's lipophilicity or its ability to dissolve in lipids versus water. Compound with excessively high log P values may have poor solubility and absorption. The number of hydrogen bond donors, usually represented by the sum of nitrogen hydrogen or oxygen hydrogen bonds capable of forming hydrogen bonds, should be less than or equal to 5. Then we have hydrogen bond acceptors, so which are typically represented by sum of nitrogen and oxygen atoms in the compound, should be less than or equal to 10. So the rationale behind these guidelines is that compounds meeting this criteria are more likely to have Favorable pharmacokinetic properties including better absorption, distribution, metabolism, and excretion profiles. Specifically, compounds adhering to the rule of 5 are more likely to be orally bioavailable as they are more likely to pass through the biological membranes and reach the systemic circulation. It is important to note that while the rule of 5 provides useful guidelines, it is not a strict rule and exceptions exist. Many successful drugs do not meet all the criteria outlined by rule of 5. However, adherence to these guidelines increases the likelihood of a compound progressing through the drug, drug development processes successfully. Therefore, rule of 5 serves as a valuable tool for guiding early stage drug discovery efforts. So, I have a question. What does Lipinski's rule of 5 state regarding the molecular weight of a compound? Thank you for your answers. Yeah, it should be less than 500 Daltons for a molecule to be drug likeliness to have. So, computer aided drug design can be broadly classified into four main cases based on the availability of protein structure. We have structure based drug design, fragment based drug design, ligand based drug design, and hybrid approaches. The structure based drug design approach involves the use of protein structures to guide the design of the drug molecules. It is typically used when structure of a protein target is available. In structure based drug design, computational methods are used to identify the potential binding sites on protein surface, and then small molecule compounds are designed to optimize the binding, optimized to bind specifically to these sites. Then we have fragment based drug design. It's a similar approach to structure based drug design but involves the use of smaller and fragment sized molecules to identify the potential binding sites on the protein surface. These fragments are then linked together to form larger compounds with higher affinity and specificity for target proteins. Then we have ligand based method. So one can consider structure based and ligand based are two major classes among the existing methods, and other classes are either fall under or be similar to them. So this ligand based drug discovery is used when protein structure is not available or it is difficult to obtain. In this approach, a library of small molecules that have already been characterized and their binding affinity for target protein is known or used. So the structure of a protein is not considered in the initial phase, and design of new drug molecules is based on the properties of these known ligands. Hybrid approaches. As the name suggests, this approaches combines both structure based and ligand based methods. It is used when the protein structure is only partially available or when the binding site on the protein is known but the structure is not available. In this approach, computational methods are used to generate a library of small molecules that are docked onto the target protein. The resulting complex is then optimized using a combination of structure based and ligand based approaches. In summary, the choice of which computer-aided drug design approach to use depends on the availability of protein structures or other factors as the size of the target protein and decides specificity of the drug. Each approach has its own strengths and limitations, and one researchers often use a combination of these methods to increase the chances of success in drug discovery. So, which approach in CAD, that is computer-aided drug design, relies on the availability of protein structures to guide the design of drug molecules? method under the computer-aided drug design relies on the so considering here sometimes the hybrid approaches will be combination of methods under similar same class. So here we have structure based drug design technique that relies on the availability of protein structures. So to start with the detailed explanation of structure based drug design, so this method involves studying the three-dimensional structure of a target molecule, often a protein or enzyme, to design small molecules that bind to the specific sites on target, thereby altering its activity and potentially improving the therapeutic benefits. The structure-based drug design process typically consists of several key steps. So the steps are mentioned here. Initially, one identify the specific protein or enzyme implicated in particular disease process that could serve as a target for drug intervention. Various techniques such as high throughput screening, genetic analysis, or molecular modeling may be employed for target identification. Once a target protein is identified, its three-dimensional structure is determined using advanced techniques like X-ray crystallography, NMR spectroscopy, and cryo-electron microscopy. This structural information reveals the protein shape, surface features, and potential binding sites for drug molecules. Computational methods are then used to design small molecules capable of binding to the target protein. One generate a library of potential drug candidates and screen them for their ability to bind to the target protein to molecular docking simulation. This step helps identifying promising drug candidates based on the factors like binding affinity, specificity, and predicted pharmacological properties. Once the promising drug candidates are identified through molecular modeling, they are further optimized through various techniques including synthetic chemistry, structural modifications, or enhancement of pharmacokinetic properties. Once an optimized lead compound is obtained, it undergoes rigorous preclinical testing to evaluate its safety and efficacy. This involves testing in animal models to assess potential side effects and toxicity. If the lead compound demonstrates safety and efficacy in preclinical studies, it advances to the clinical trials in humans. In summary, this structure-based drug design enables the design of highly specific and effective drugs with minimal side effects by leveraging the structural information of target molecule. While structure-based drug design is a complex and time-consuming process, it has a potential to revolutionize drug development and improve treatments for a wide range of diseases. So docking is a computational technique central to structure-based drug design and also aims to predict how a potential drug molecule interacts with the target protein or enzyme. It involves assessing the energetics and geometrics of the interaction between the drug candidate and protein target, aiding in the identification of compounds likely to bind with high affinity and selectivity. So the steps in the docking are listed here. First step is preparation of protein and ligand. So the target protein and ligand undergo preparation to eliminate the interfering elements like water molecules or unwanted residues. This typically involves removing crystallographic water from protein and optimizing the ligand's geometry and charges. Analyzing the protein structure helps identify potential binding pockets or cavities on its surface, determining where the ligand will bind. The ligand is initially positioned within the binding site. This can be accomplished through various methods such as random placing or utilizing shape-based matching algorithms. The interactions between the ligand and protein is assessed using a scoring function, evaluating the energy and geometry of the complex. The aim is to find the optimal orientation and conformation of the ligand that maximizes the binding affinity and specificity. Ligands are ranked based on the predicted binding affinities. The predicted dog poses are validated and refined using experimental data. This helps to identify potential inaccuracies and refine the docking protocols for improved accuracy. Multiple software programs are available for docking calculations such as Autodock, Gold, Glide, Flex, These programs utilize different algorithms and scoring functions to predict the ligand protein interactions. In docking, scoring functions plays a crucial role in assessing the binding affinity between ligand molecule and a protein target. The primary objective of docking is to identify the most favorable conformation of the ligand within the protein binding site. And scoring function offers a quantitative measure of the interaction strength between the ligand and the protein. So here I have listed some main classes of scoring functions used in docking, that is empirical scoring functions, force field based scoring functions, knowledge based scoring functions, and machine learning based scoring functions. So empirical scoring functions, these functions rely on statistical analysis of experiments to determine protein ligand complexes. Parameters include parameters describing various interactions such as van der Waals, electrostatic hydrogen bonding and dissolution energies. New docking posts are scores based on their resemblance to the training set. We have scores based force field based scoring functions which utilize molecular mechanics force fields to describe the potential energy of the ligand protein complex. Parameters defining bond, angle, dihedral and non-bonded interactions are employed to calculate the complex potential energy. The resulting energy is used to score the docking poses. Then we have knowledge based scoring functions which are derived from statistical analysis of non-covalent interactions within the protein ligand complexes that are whose structure is experimentally derived. So distance dependent potential function receive the frequencies of observed interactions in the training set. Docking poses are scored based on the similarity to the training. So we have the machine learning which utilize machine learning algorithms to learn the relationship between the protein ligand interaction energies and molecular descriptors. So the common docking programs and their associated scoring functions include AutoDock, which employs empirical scoring functions based on van der Waals and electrostatic parameters. Gold, which uses a ChemScore empirical scoring function incorporating 16 interaction terms which include van der Waals, hydrogen and metal coordination related energy parameters. So Glide, which uses MMGBSA force field based scoring function integrating molecular mechanics calculations with a generalized solvent model. Flex employs empirical scoring function which includes 30 interaction terms. The selection of a scoring function depends on factors such as protein ligand complexities, desired accuracies, and speed and availability of computational resources. Each scoring function has its strength and limitation, making it essential to choose one that best fits the specific requirements of the docking calculation. In docking programs, two primary types of search algorithms are typically employed to navigate the conformational space of ligand molecule and determine its optimal orientation and conformation within the protein binding site. So we have global search algorithms and local search algorithms. So global search algorithms explore a vast conformational space primarily utilized in the initial stages of docking to locate the approximate binding site and the orientation of the ligand. Examples include genetic algorithms, simulated annealing, Monte Carlo simulations, and particle swarm optimization. Then we have local search algorithms which refine the binding mode and enhance the ligand's binding affinity within the binding site. These algorithms may work by making small adjustments to the ligand's position, orientation, or conformation and assessing the resulting binding affinities. Local search methods encompass gradient-based optimization, quasi-Newton methods, and stochastic optimization. Certain docking programs may integrate a blend of both the global and local search algorithms to balance the exploration of conformational space with the optimization of binding affinity. The choice of algorithms hinges on the factors such as program's underlying algorithms, size and complexity of the molecules involved, and availability of computational space. So the previous algorithms like existing methods such as orthodox employs a genetic algorithm for global search and a quasi-Newton method for local search. Gold utilizes a genetic algorithm for global search and a modified simplex method for sorry. Yeah. Glide employs a hierarchical search algorithm combining a genetic algorithm for global search with a gradient based optimization algorithm for local search. Flex again uses Monte Carlo search algorithm for global exploration and a simplex optimization algorithm for local refinement. So here we have a concept of virtual screening. Virtual screening is an important computational method in drug discovery aimed at pinpointing potential drug candidates from extensive compound libraries. This process unfolds through several steps. So initiated by the choosing a target for drug candidate which could be disease involved protein or enzyme. Next, a vast database of compounds sourced from commercial platforms, databases are virtually generated, serves as a foundation for screening. The protein structure undergoes meticulous preparation including removal of water molecules and other ligands and optimization for stability and accuracy. Each compound within the library is prepped for docking and involving hydrogen addition, molecular geometry optimization and generation of multiple conformations. These prepared compounds are then docked onto a protein structure using a sophisticated algorithms. So includes ex- this step explores various ligand protein orientations and evaluates their interactions to calculate binding affinity. Post docking, compounds receive scores based on their predicted binding affinity to the protein. Scoring function which consider factors like electrostatic van der Waals hydrogen bond vary depending on the employed docking algorithm. Compounds exhibiting the highest predicted binding affinity are identified as potential hits, and these hits undergo further scrutiny using computational experimental methods to ascertain the most promising drug candidates. The most promising drug candidates are then subjected to iterative optimization for enhanced potency, selectivity, and safety. This iterative process entails designing and synthesizing new compounds based on the chemical structure of the initial hits, followed by testing for activity against the target. So virtual screening harnesses the computational power to comb through the compound libraries and identify promising drug candidates and optimize them iteratively, thus serving as a pivotal step in the drug discovery pipeline. So one of the important concepts, sorry. So what is the purpose of a scoring function in docking? So yeah, after this I have two more concepts to discuss before moving on to this. So we after this I'll be discussing a pharmacophore modeling and QSAR. it is mostly about to assess the energetics and geometry of the protein ligand interactions. The methods, the computational methods or statistical based methods to identify the binding sites has been discussed in a previous class. They include distance based method, energy based method, and ASA based methods. So, but those doesn't come under scoring functions. Scoring functions assess the energetics and geometry of the protein ligand interactions. So, pharmacophore modeling is a computational technique used in drug discovery to identify and design small molecules that bind to a specific target protein. This technique involves identification of key molecular features or pharmacophores that are required for molecule to bind to the protein. The first step in pharmacophore modeling is to select a target protein for drug candidate. This protein can be receptor, enzyme, or any other molecule involved in this pathway. A dataset of known ligands that bind to a target protein is collected from literature, databases, or other sources, and the ligands can be small molecules, peptides, or other types of compounds. The ligands dataset is used to generate a pharmacophore model using a pharmacophore modeling software tool. The pharmacophore model consists of key molecular features or pharmacophores that are essential for ligand binding to the protein. These pharmacophores can be hydrogen bond acceptors, hydrogen bond donors, hydrophobic regions, aromatic rings, or other chemical features. Then the generated pharmacophore model is validated by comparing it to the known ligands that is bind to target protein. The model is refined and optimized until it accurately represents the binding requirements of the ligands. The validated pharmacophore model is used to screen large compound databases to identify potential drug candidates. The compounds are evaluated based on their ability to fit the pharmacophore model and their predicted binding affinities to the target protein. The compounds with highest predicted binding affinity to a target protein are selected as potential hits. These compounds can then be further analyzed using other computational experimental techniques to identify the most promising drug candidates. So one of the commonly used softwares for pharmacophore modeling is Ligand Scout, MOE, Molecular Operating Environment, Discovery Studio, and PharmGist. Next we have QSR. One second. QSR stands for Quantitative Structure Activity Relationship. It's a computational modeling approach used to predict the biological activity of molecules based on their chemical structure. QSR models are built by analyzing the relationship between the molecular structure of a compound and its biological activity. The resulting QSR models can be used to predict the activity of new and untested compounds. The need for QSR arises from need to quickly and accurately identify active compounds for drug discovery and development. Traditional methods of drug discovery involve synthesizing and testing a large number of compounds to identify those that have desired biological activity. This process is time consuming, expensive, and requires a significant amount of resources. QSR offers a more efficient approach to drug discovery by using computational methods to predict the biological activity of compounds. QSR models can be used to identify compounds with a desired activity, reducing the need for extensive synthesis and testing. Additionally, QSR models can provide insights into the structure-activity relationships of compounds, helping researchers to identify and understand the molecular mechanisms underlying their biological activity. So, the development of a QSR model typically involves several steps including data collection, descriptor calculation, model building, and model validation. Data collection involves gathering experimental data on biological activity of set of compounds. Descriptor calculation involves calculating a set of molecular descriptors that describe the chemical and physical properties of the compound. Model building involves using statistical or machine learning algorithms to identify the relationship between the molecular descriptors and their biological activity. Model validation involves evaluating the performance of QSR model using a test set that were not used to build the model. So this QSAR is a valuable tool for discovery and development, offering an efficient and cost-effective approach to identify active compounds and understand the structure activity relationship. So the first step in QSAR is to collect the dataset of compounds with non-biological activity. The dataset should be diverse and representative of the chemical space of interest. The next step is to calculate a set of molecular descriptors for each compound in the dataset. The molecular descriptors are numerical values that represent the chemical and physical properties of the compound. So these include such as molecular weight, number of hydrogen bond donors, polar surface area. Then these descriptors are used as input variables in the QSR model. The dataset is then pre-processed to remove any duplicate outliers or missing values. The dataset is also divided into training and test set validation. The next step is to build a QSR model using a statistical or machine learning algorithms. The training set is used to train the model and the validation set is to evaluate the performance of the model. So I have few questions here. So what is the primary purpose of QSAR modeling? Whether the primary purpose is to predict the toxicity of compounds or to predict the biological activity of compounds based on their chemical structure or to synthesize new compounds based on known structures or to assess the drug likeliness of potential compounds. So it is used for predicting the biological activity. Thank you for the answers. So most of the steps I have discussed. So in this model building step and all, so a statistical or machine learning algorithm will be used. So the training set is used to train the model and the validation set is used to evaluate the performance of the model. The model is typically evaluated based on metrics such as mean absolute error, correlation with the experimental values. Once a QSAR model has been built, model has to be validated using an external dataset of compounds. The external dataset should be diverse and representative of chemical space of interest. Finally, is to interpret the QSR model to gain insights into the structure activity relationships of the compounds. This can be done by analyzing the coefficients of the model and identifying the molecular descriptors that are most important for predicting the biological activity of. So there are wide range of molecular properties that can be used as a input variable in QSR model depending on specific application and chemical space of interest. So we have constitutional descriptors which reflect the molecular structure of the compound such as number of atoms, bonds and rings. Then we have topological descriptors which reflect the connectivity of atoms in the molecule such as number of branches and cycles. Then we have geometrical descriptors that reflect the shape and size of the molecule such as molecular volume and surface area. We have electronic descriptors which reflect the electronic structure of a molecule. Hydrophobicity descriptors that reflect the hydrophobic or hydrophilic nature of the molecules. So the choice of molecular properties to be used in QSR model depends upon the specific application and availability of data. It is important to choose a set of properties that are relevant to biological activity of compounds and that can capture diversity of chemical space of interest. So that's all questions from today. If there are any questions, I'm ready to take before starting the quiz. If not, I'll proceed with the quiz questions. Okay, the first question here is virtual screening is used for one ligand, one protein, many ligands, many proteins, one ligand, or none of the above. So, virtual screening is used for one protein and many ligands. QSAR is based on the notion that activity is a function of structure, activity is a function of molecular properties, activity is a function of physical properties, or all of the above. QSR stands for activity is a function of molecular properties or molecular descriptors. So residue and atom binding propensities are used in what type of scoring function? is a knowledge based. Residue and atom binding properties are used in knowledge based scoring functions. So, which of the following are measurable molecular descriptors? Whether refractive index, pKa, dipole moment, or all of the above. So all of these refractive index, pKa and dipole moment, all of these values can be used as a molecular descriptors. So here I have a question regarding a cross validation technique with the name jackknife test. So how many data points are used for training in a jackknife test for a data set of n data points per iteration? So how many data points are used for training in jackknife test for a data set of n data points per iteration? So if a data set has training of n data points, how many of them are used per iteration in jackknife training cross validation? So the other name for jackknife cross validation is also known as leave one out cross validation. So in each iteration out of the n data points, one data point is left out as a test set, so training on remaining n minus 1 data points. So these iterations are continued so that each data point has been once appeared in the test set. So if the Pearson correlation coefficient between the two sets of data is 0, then what could be infer from that, whether these two data sets have no correlation, positive correlation, random relationship, or negative correlation? So they define no correlation. So here, what do docking scores tell? So choose the application of the docking scores from the below to fix a particular position of the ligand, to reduce the degrees of freedom, to rank the active compounds, or all of the above. So the major role of docking scores is to rank the active compounds. So here I have a question. Use the given data below to answer the questions. The IC50 values of two protein ligand complexes are 15 nanomolar and 6 nanomolar. And the IC50 values are related to hydrogen bond donors 4 and 3 respectively, and polar surface area 3 and 4 respectively. Yeah. Mention the regression coefficient of hydrogen bond donor, regression coefficient of polar surface area, and also mention the IC50 value of a compound with 3 hydrogen bonds and polar surface area of 3. So try to build the equations like this. Here for the first complex IC50 value 15 nanomolar have related to 4 hydrogen bond donors and its regression coefficient x, plus polar surface area of 3 and its regression coefficient y. So this is how two equations are generated. Now solve these two equations for x and y values. solve the equation 1 and equation 2 and find out the x and y values. So on solving this equation, the regression coefficient for hydrogen bond donor is 6 and the regression coefficient for polar surface area is -3, and the IC50 of a value of a compound with 3 hydrogen bond donors and polar surface area is 9. So similarly, I have one more question. Again, here I have changed the values. Now the equations are 4 equals to 2x plus 5 and 9 equals to x plus 4y. Solve the two equations for x and y values, then implement those x and y values in the third point, that is 3x plus 3y equals to what? Yeah, so the value of x equals to 1, y equals to 2. So if we combine x and y, so it is the IC50 value of a compound with 3 hydrogen bond donors and a polar surface area of 3 is, so the equation here is 3x plus 3y. So 3 into 1 plus 3 into 2. So 3 plus 6. So it is 9. So here I have taken with more number of equations. So hope this will be the last question for today. So here I have IC50 values for 3 protein ligand complexes and 3 values of hydrogen bond donors, hydrogen bond acceptors, and polar surface area have been given. So here you have 3 equations that are formed. Using the 3 equations, find the x, y and z values. Once you have x and y, z values, the IC50 of a compound, find the IC50 of the 3 hydrogen bonds, 3 hydrogen bond acceptors, 3 hydrogen bond donors and polar surface area of 2 is to be calculated. Previously we have solved 2 equations with 2 variables. Here we will be solving 3 equations with 3 variables. So that's all for today I have. If you have any other questions you can ask me. If not, you can just solve these problems and mention me the answers. So I'll wait still for a minute if others are trying. Okay, so here we have three equations relating the descriptors of three ligand complexes with their affinity values. When you solve for this, the value of x is 1, y is 2 and z is minus 2. So substituting this, we have the IC50 value for a new compound is 5 nanomolar. Okay, just give me a second, let me cross verify the answers. So that's all for today. If you have any other questions, I'll take up. If not, you are free to leave the class. Thanks for attending. Yeah, will be the slides will be available under the live problem solving sessions in NPTEL Swayam uh, portal. So not only this, all the previous week from week 1 to week 10 slides will be available. So these slides will be made you available at most by tomorrow. So you can access these slides at most by tomorrow.